Hello, my name is Sharon Engelhardt, and this is my presentation for Leadership in Healthcare System Practicum. This is improving the quality of life for patients with diabetes and recognizing the value of the certified diabetes care and education specialist. Um, I am at Grand Canyon University, and my preceptor is Dr. Janice Hill. My professor is Dr. Janice Hill. The objectives of my project are to tell you a little bit about the site where my practicum and my project was performed, the needs assessment of the problem that I identified, a project topic and my project goals, the project outcomes or our anticipated outcomes, review the stakeholders, the sustainability of this project, and then cover some of the AONL competencies that I learned during my practicum. And then what did I learn during this project? So Memorial Hermann Southwest Hospital is where my project and my practicum, and also where I work, was performed. It is a 541 bed facility. It serves Southwest Houston. It is one of 11 acute care hospitals in the greater Memorial Hermann system. It's a designated comprehensive stroke center, has an on-site tier inpatient rehabilitation rehab facility. We're working on our third magnet recognition. And then we have a diabetes education program that covers both our inpatients and our outpatients also. And the outpatient is recognized by the American Diabetes Association. My preceptor during my practicum was Miss Cindy Garza. She's an administrative director at Memorial Hermann Southwest. She's over nursing excellence, nursing and supplemental services, the clinical care redesign, clinical nutrition, and our volunteer services. So I wanted to make sure that my project aligned with Memorial Hermann's mission, vision, value, their service commitment, and our service standards. So at Memorial Hermann, our mission is that we are a nonprofit, values-driven, community-owned healthcare system, and we're dedicated to improving health. Our vision is that we'll create healthier communities now and for generations to come. Our values are community, compassion, courage, credibility. Our service commitment is that we care for every member of our community by creating compassionate and personalized care. And then our service standards are safe, caring, personalized, and efficient patient care. So the needs or assessment or the problem that we identified was that our patients with diabetes were getting discharged without all of the needed supplies, referrals, resources that they needed. This often includes a glucometer and the testing supplies that go along with a glucometer. I see patients going home with insulin, but the doctors, providers maybe forgot to do prescription for syringes, pen needles. Even though these can be bought over the counter without a prescription, usually people with insurance want the prescription so that the insurance will help with the cost. We need to have a plan for their follow-up. If they don't have a PCP, we need a referral for one. We want to make sure that they have prescription refills for at least 90 days. And then hopefully we can refer them to our outpatient diabetes education program. There was a patient that called in with a complaint when I was early into my practicum. She had been inpatient with DKA, with diabetic ketoacidosis, new diagnosis of diabetes. She went home without, she did have a glucometer, but it was a starter kit, so she didn't have a prescription for additional testing supplies. She ran out of supplies right away because she was, scared and was checking her blood sugar quite often. When she called me, she was very upset and scared because the cost of the testing strips without a prescription was more than she was able to afford. Um, so with this gap, I decided that this would be a good project for my practicum. I discussed it with my director and Mrs. Garza, my preceptor, and they also agreed. Um, so what we want to make sure that we address with my project is that our patients with diabetes have the needed supplies, any referrals, and the resources they need at discharge to self-manage their diabetes. The goal of this project is so that patients will have enhanced outcomes, will increase the patient satisfaction, and then reduce readmission rates. So our outcomes, our anticipated outcomes will again be that patients with diabetes, upon discharge, they will have the needed supplies or prescription for supplies, referrals, and resources so that they can self-manage diabetes. This will help to prevent or reduce chronic illnesses that are associated with diabetes. And then this will also help with readmissions and comorbidities. So for this project, my stakeholders were, of course, the providers, the physician and the nurse practitioners that are writing orders. I had to get approval from my executive team. The IT staff is helping me to get permission for the CDCSs to put in secondary orders so that we can put those orders in, the doctors review them, sign off, um, and then hopefully there will be little to no gaps. My director, um, I spoke with the other certified diabetic care and education specialists throughout the Memorial Hermann system to get their feedback and input. Our bedside nurses, our dietitians, of course, the patients. And then at Memorial Hermann Southwest, we have an in-house pharmacy, and the pharmacist there is a great help to me as well. So what my project proposes is that we are able as CDCSs to put in secondary orders. This will allow the doctors to see these orders easily, review them, sign off on any that they agree with, ignore the ones that they don't agree with. Currently, our process in the past was to put all this information in the notes, and sometimes our providers just don't have time to read the notes before they discharge a patient. With the orders, it'll be more concise and easy for them to sign off on. So with our Medicare and our commercially insurance patients, we want to make sure they have a glucometer, they have testing supplies such as the testing strips, the lances, the lancing device, the alcohol swabs. Some patients may qualify or benefit from a continuous glucose monitor. We're lucky that we have a program with Libra 3 or Libra where we get sensors, samples that we're able to put on the patient at discharge, help them download the app, teach them how to use it. That will give them better control over their blood sugar without so many finger sticks. Often I see patients going home with insulin without a prescription for syringes or pen needles, insulin pen needles. So we want to make sure those are in there or be able to put those orders in for our providers to sign off on. And then even our insured patients don't always have an established relationship with a primary care physician. So we want to be able to give those referrals. And then with Epic, there's a way to put an ambulatory referral to our outpatient diabetes class so those patients can get ongoing education and coaching and guidance to self-manage diabetes. So we want to also mirror this as closely as possible for our self-pay non-insured patients. There are glucometers that are closer to about $10. 50 testing strips is $10. So we want to be able to give them a handout with those referrals. We want to be able to make sure that when they have insulin, that there's refills for at least 90 days, sometimes longer. With our inpatient pharmacy, there is a program for low-income patients called 340B. We put a referral in for our social workers. They make sure our patients qualify for that, refer them. The prescription is sent to our in-house pharmacy, and hopefully our patients will have the needed medications and supplies in hand at discharge. And that also goes for our insured patients as well. We want to be able to make sure that our non-insured patients have referrals to low-cost clinics. Some of our patients qualify for a one-time follow-up with our residents at Physicians of Sugar Creek. There is an education program that is no cost, and we can send referrals. It's called the DAWN program. It's Diabetes Awareness Wellness Network. And then at Memorial Hermann Southwest, we also have a community resource center. In this resource center, we have usually bilingual staff that's able to help our patients to apply for different county programs that help with them seeing doctors and helping them with the cost of their medications. They will assist them in applying for SNAP benefits if necessary. We even have a on-site food bank with a full-time pharmacist, and she does education at like a food pharmacy where she helps them if they have diabetes, hypertension, high cholesterol, helps them pick out foods that will help manage their the comorbidities they have. So for sustainability of this program, we're going to do a pilot. We're currently doing a pilot at Memorial Hermann Southwest. Once we kind of work out some of the kinks, get Epic up to par, putting in our secondary orders, then hopefully we can have all of Memorial Hermann campuses with diabetic educators using this project. Continually have to train and our providers and our nurses, of course. And then I'm working on developing a multidisciplinary diabetes readmission review template. This will be mirrored after one that my preceptor did for congestive heart failure. We'll get feedback and adjustments to our process as needed. And then if at any point ever needed, I will hand this off to another CDCES. Some of the American Organization of Nursing Leadership core competencies that I have learned during my practicum are effective communication, influencing behaviors, patient safety and quality, patient advocacy, health equity and social determinants of health, which is a passion of mine, and then how to use reflective practice. My preceptor, Ms. Garza, was very good at debriefing me after any meetings that I attended with her to help me answer questions and to learn. And that's, I see that is very effective with nurse leadership. Some of the lessons that we've learned during this project, of course, diabetes, it affects more than 500 million people globally. That's expected only to continue rising. By the year 2030, it's supposed to be up to 640 million people globally. We have a discharge callback that our nurses do to go over with our patients that were recently discharged. So anytime there's a patient that has questions about diabetes or their supplies, their medications, they send that notice to me and I reach out to the patient and try to help them. One of the things that we haven't worked all the kinks out that I'm still working on is the Epic, the IT accessibility of putting in the secondary orders to make it more of a smooth transition. Currently, our process is to message the provider with a list of what the patient needs. They still have to take time to put in those orders. We want to be able to do it for them and then just check off on it. There continues to be challenges with our self-pay patients, with our homeless population, and then we have patients with substance abuse, and our social workers are great at helping us with that. So we continue to put referrals in for those. And then the form that our template that to use for the readmissions, we want to be able to look at um, DRGs that are associated with diabetes codes or DKA and see if our readmission rates are coming down. So thank you for taking time to listen to my presentation. Also want to thank my preceptor, Miss Garza, Cindy Garza. She was always professional, such a great mentor and leader, helping me through my practicum. I also want to thank my professor, Dr. Janice Hill. She was great with direction and grace during my last semester in the MSN program. I've included here my personal email if anyone has any questions about my presentation. And I want to thank you for your time. Thank you.